Our resource person graduated as a gold medalist from Manila Science High School. She took her pre-medical course, BS Biology Accelerated at the University of Santo Tomas, where she graduated magna cum laude. She pursued her degree, Doctor of Medicine and Surgery, at the same institution. She is a practicing obstetrician, gynecologist, and holds clinic at the UDL Medical Building along Taft Avenue, Manila. Let us welcome Dr. Lorelai Monina Gallo-Canono.
Can you please give us a brief explanation about the respiratory system?
So the human respiratory system is a series of organs responsible for breathing or respiration. In other words, it is responsible for taking in oxygen from the atmosphere and expelling carbon dioxide from the body.
Aside from respiration, does the respiratory system have any other functions?
Yes, it does. It helps facilitate the sense of smell, it influences speech, it filters, warms, and humidifies the air that we inhale. It also has a protective function since it filters out foreign materials such as dust and bacteria and other organisms.
Could you please enumerate the parts of the respiratory system and give its functions?
Okay, first we have the nose, which is important in olfaction or smelling. It also serves as a resonating chamber for speech. It also filters out bacteria and dust. It also humidifies and warms the air that we breathe in. The next structure is the pharynx or throat. This is a conduit for both food and air. Next, we have the larynx or the voice box. The larynx, aside from conducting oxygen that we get from the atmosphere, also contains the vocal cords, which vibrate to produce speech. Next is the trachea or windpipe, which branches out into two bronchi and then eventually into smaller bronchioles, which end in the lungs. The lungs are made up of millions of tiny air sacs called alveoli. It is here where actual gas exchange occurs. Lastly, we have the diaphragm, which is a muscular organ found at the bottom of the lungs. It also separates the chest cavity from the abdominal cavity, and it controls our breathing.
What respiratory diseases have you encountered in your private practice and how do you treat them?
Well, the most common would be upper respiratory tract infections. These infections could either be caused by viruses or bacteria. Patients with these infections usually come in and present with cough, colds, fever, and malaise. Treatment is mainly supportive for viral infections. So I give my patients vitamins to boost their immune system. I ask them to hydrate and drink lots of fluids, especially water. I give them paracetamol to bring down the fever, and I usually advise them to get plenty of rest. For bacterial cases, I give them antibiotics, usually the cephalosporins, which are safe for pregnancy. Next disease is bacterial pneumonia. Community-acquired pneumonia is usually caused by Streptococcus pneumoniae, Haemophilus influenzae, and Mycoplasma pneumoniae. Patients with pneumonia usually have cough, fever, chills, chest pain, and difficulty in breathing. They may also present with greenish or yellowish phlegm, and when we listen to their lungs, we can hear coarse crackles. Treatment is by giving oral antibiotics. We usually give the beta-lactams and the macrolides like clarithromycin, which are usually safe in pregnant women. Supportive measures include giving oxygen, rehydrating, and chest physiotherapy is also important to clear out secretions and improve oxygenation of the patient.
Does being pregnant have an effect on the course of pneumonia?
Yes, it does. Pneumonia in pregnancy is usually more severe and mortality is higher. There is also an increased risk of maternal complications like respiratory failure, which could lead to death.
Does pneumonia have an effect on pregnancy?
Yes, severe pneumonia can in fact lead to preterm delivery and low birth weight infants. So the next disease is asthma. This is a chronic inflammation of the lung airways. Patients usually present with coughing, wheezing, chest tightness, or shortness of breath. Treatment for pregnant patients are the same as for the non-pregnant population. We usually give beta-2 agonists. These are bronchodilators to dilate the muscles lining the airways to facilitate the flow of oxygen into the lungs. We usually give also inhaled steroids to bring down the inflammation. For severe cases, that is the time we give oral steroids. We can also give oxygen and rehydrate the patient.
What usually triggers an asthma attack?
Triggers usually involve chemicals, solvents, fumes, air pollution, dust, cold air, food, medications, and even exercise can trigger an asthma attack.
How can we prevent asthma attacks?
Well, we can prevent asthma attacks by avoiding triggering factors, maintaining an ideal body weight, eating a well-balanced diet, and exercise.
Does asthma have any effects on pregnancy?
Well, there have been reports of an association between uncontrolled asthma and several pregnancy complications like hyperemesis, preterm birth, low birth weight infants, growth restriction in the fetus, vaginal bleeding, neonatal hypoxia, and hypertension, as well as preeclampsia.
Doctor, how can we prevent such respiratory diseases?
So we can prevent respiratory diseases by keeping our bodies healthy. We should eat a well-balanced diet. We should exercise regularly. We should avoid smoking, avoid stress, get enough sleep and rest, and we should avoid close contact with sick people.
Based on your academic background, will you please give us a brief introduction about the circulatory system?
Well, the circulatory system is a vast network of organs and vessels responsible for the flow of blood, nutrients, hormones, oxygen, and other gases to and from cells. Without the circulatory system, our body would not be able to fight off infection or maintain a stable internal environment, such as proper temperature and pH.
Could you please tell us the parts of the circulatory system and their functions?
Well, the main organ of the circulatory system is the heart. It is a hollow muscular organ responsible for pumping blood throughout the body. Next, we have the blood vessels, namely the arteries, the veins, and the capillaries. These are tubular structures which convey blood to the different parts of the body. Lastly, we have blood, the main function of which is to transport oxygen to the body cells and tissues.
Since blood is very vital to our existence, does it have any other function aside from transporting oxygen?
Yes, it has other functions like transporting nutrients to and from the cells. It picks up carbon dioxide from cells and brings it back to the lungs for exhalation. It also transports hormones, enzymes, proteins. It picks up metabolic waste and brings them to the liver and the kidneys for excretion. It is also important in fighting off infection since it carries cells and antibodies which help fight infection. It is also important in regulating our body temperature, pH, and blood pressure. It is also important in the clotting mechanism, especially when you have an injury.
Based on these varied functions, we can deduce that blood is made up of different components. Could you please tell us what they are and what specific roles do they play?
Well, 55% of our blood is made up of plasma. This is the liquid component of our blood. Its main job is to transport blood cells throughout the body along with nutrients, waste products, hormones, and other substances. Next, we have the red blood cells or erythrocytes. These are the most abundant cells in the blood, accounting for 45% of its volume. Its main function is to carry oxygen to the different parts of the body and bring back carbon dioxide from the cells to the lungs for exhalation. Next, we have the white blood cells or leukocytes. These help fight infections in the body. Lastly, we have the platelets or thrombocytes. These are not actually cells, but rather are small fragments of cells which are important in the clotting mechanism.
I have often wondered why our blood is red. Could you please tell us why?
Well, blood is palely red because of the large number of RBCs or erythrocytes in the blood. As I have mentioned, it comprises 45% of its volume. It gets its red color from the hemoglobin, which is a special protein found in red blood cells.
When you operate on a patient, you can see the blood vessels, right?
Yes.
Are our veins really blue?
No, our veins are not actually blue. They just appear blue because they are located near the surface of our skin. And only blue light can penetrate the skin up to the level of the veins. So that is the color that is reflected back to our eyes.
Could you please explain how our blood flows throughout the body?
Deoxygenated blood from the upper part of the body flows through the superior vena cava into the right atrium, while deoxygenated blood from the lower part of the body flows through the inferior vena cava into the right atrium. When the right atrium contracts, it opens the tricuspid valve and blood flows into the right ventricle. When the right ventricle contracts, it closes the tricuspid valve to prevent backflow of blood from the right ventricle into the right atrium and forces open the pulmonic valve, and the blood then enters into the pulmonary artery. The blood in the pulmonary artery is then carried to the lungs, where it releases carbon dioxide and picks up oxygen. The oxygenated blood from the lungs are brought back to the left atrium via the pulmonary vein. When the left atrium contracts, it opens the mitral valve or bicuspid valve and blood flows into the left ventricle. When the left ventricle contracts, it closes the mitral valve and opens the aortic valve so blood can flow from the left ventricle into the aorta, and blood is then distributed to the different parts of the body.
Being an obstetrician, could you please tell us how blood flows from the mother to the fetus?
Well, blood flows from the mother to the fetus via the placenta, which is found inside the mother's uterus, and the umbilical cord, which extends from the placenta to the fetus. The umbilical cord is composed of one umbilical vein and two umbilical arteries.
In your private practice as an OB/GYN, what circulatory disorders do you usually encounter and how do you treat them?
Well, one is anemia. This is the most common hematologic problem in pregnancy. It is usually caused by iron deficiency. As for my non-pregnant patients, they usually develop anemia from heavy, prolonged vaginal bleeding. Patients with anemia usually experience dizziness, they may have palpitations, they could look pale, they could have difficulty in breathing. Now, we usually treat these patients by giving iron supplements and advising them to eat foods rich in iron, such as meat and liver. Blood transfusion is usually done in severe cases.
How does one prevent anemia?
Well, we can prevent anemia by taking daily doses of iron supplements, by eating food rich in iron like meat and liver, by practicing good personal hygiene, and improving one's sanitation and frequent hand washing to prevent parasitic infections, and proper birth spacing for women so that they will have time to recover from blood loss during delivery.
Does anemia have an effect on the fetus?
Yes, anemia can lead to low birth weight, fetal growth restriction. It can lead to preterm delivery and developmental delays. Another circulatory disorder is abnormal uterine bleeding. My patients usually present with irregular or heavy or prolonged vaginal bleeding, which usually leads to anemia. I usually give antiprostaglandins, fibrinolytics, and oral contraceptives to help stop the bleeding. Now, surgery such as curettage is usually done in severe cases or if it doesn't respond to oral medications. Another common circulatory disorder in pregnancy is hypertension. Patients may present with blurring of vision, headache, difficulty in breathing, right upper quadrant pain. There are 4 categories of hypertension in pregnancy, namely preeclampsia, eclampsia. We have chronic hypertension. We also have chronic hypertension with superimposed preeclampsia and gestational hypertension.
When can you say that a person is hypertensive?
Well, a person is considered hypertensive when the blood pressure is greater than or equal to 140/90 millimeters mercury.
How do you treat your patients with hypertension?
Well, we usually give antihypertensive medications for severe cases. We also advise the patient to get enough rest, to avoid stress, to have a low salt, low fat, and high fiber diet.
We would like to thank Dr. Gallo-Canono for this very informative discussion
about the circulatory system and the respiratory system.
As a token of our appreciation, we would like to present this gift.